can't feel it. You can't see it. You may not have even heard of it. But a silent killer is in our midst. This silent killer is the leading risk of premature death in the world, well above smoking and infectious diseases. This killer is not located in a remote African jungle, or hiding somewhere down in the mountains. It is right here, in our backyards, in our living room, in our bedrooms. According to World Health Organization, about 1.28 billion adults aged 30 to 79 years worldwide have this condition, most two-thirds living in low- and middle-income countries. Many don't even know they have it. This killer often gives no warning of its approach, attacking first and asking question later, when it is too late. High blood pressure is the single greatest health risk facing people today. And there may be no warning signs.
Hypertension is the medical term used for high blood pressure. Now, you may ask me, what is high blood pressure and why is this harmful to the body? Blood pressure is the force or pressure in our blood vessel, that allows the flow of blood which delivers essential nutrients and oxygen from the heart and our lungs to the rest of our body. Over time, these blood vessels, which are like pipes to which blood circulate, can actually thicken. Stiffening is often associated with non-healthy lifestyle such as smoking, decreased physical activity, diet high in fat and salt, which can cause thickening of the lining of the blood vessels, causing cholesterol and fatty plaques accumulating, which narrow further the arteries. So, what are the risk factors? Risk factors simply means things that, when present, increases your chances of developing a disease. Some of these risk factors are
Age. The risk of high blood pressure increases with age. Until about age 64, high blood pressure is more common in men. Women are more likely to develop high blood pressure too, but can occur earlier due to some other contributory factors. Race. High blood pressure is particularly common among black people. It develops at an earlier age in black people than it does in white people. Family history. You're more likely to develop high blood pressure if you have a parent or sibling with the condition. Obesity or being overweight. Excess weight causes changes in the blood vessels, the kidneys and other parts of the body. These changes often increase blood pressure. Being overweight or having obesity also raises the risk of heart disease and its risk factors, such as high cholesterol. Lack of exercise. Not exercising can cause weight gain. Increased weight raises the risk of high blood pressure. Tobacco use. Smoking, chewing tobacco not only raises blood pressure but also injures blood vessel walls and speeds up the process of hardening of the arteries. Too much salt. Cause the body to retain fluid. This increases blood pressure. Drinking too much alcohol. Alcohol use has been linked with increased blood pressure, particularly in men. Stress. High levels of stress can lead to a temporary increase in blood pressure. Stress-related habits such as eating more, using tobacco or drinking alcohol can lead to further increases in blood pressure. Certain chronic conditions. Kidney disease and diabetes are some of the conditions that can lead to high blood pressure.
over time, high blood pressure causes excess straining both from the heart and the blood vessels. This can cause damage to the blood vessels with rupture, clot formation, and finally blockage, which then leads to serious complications such
Heart
as
attack or stroke. Aneurysm. Increased blood pressure can cause a blood vessel to weaken and bulge, forming an aneurysm which can ruptures and cause death. Heart failure. When you have high blood pressure, the heart has to work harder to pump blood. The strain causes the walls of the heart's pumping chamber to thicken. The heart becomes bigger, eventually, can't pump enough blood to meet the body's needs, causing heart failure. Kidney problems. High blood pressure can cause the blood vessels in the kidneys to become narrow or weak. This can lead to kidney damage. Eye problems. Increased blood pressure can cause thickened, narrowed or torn blood vessels in the eyes. This can result in vision loss. Dementia. Narrowed or blocked arteries can limit blood flow to the brain. This can cause a certain type of dementia called vascular dementia, which is the inability to remember things, think and make decisions because blood is not getting to the brain.
The strain of the heart and blood vessels happen deep inside the body and may not even serve to any outward signs and symptoms until it's too late. The only clue may be your blood pressure measurement, which tells your doctor what is happening inside your vessels and how hard your heart is working to move blood to the body. Simply means that the higher the numbers, the higher your heart has to work and the greater the health risk. Know your numbers is the first step in taking care of your health. It's very easy to do. Blood pressure is written as two numbers. You have the first systolic number, which represents the pressure in blood vessels when the heart contracts or beats. Then the second is a diastolic number, which represents the pressure in the vessels when the heart rests in between beats. So the normal blood pressure is around 120 over 80 millimeter mercury. The higher the number, the higher the risk for stroke and heart disease. The number of 140 over 90 is considered high, that's hypertension. It may need some kind of intervention. Treatment usually begins with lifestyle modification, followed in some cases by medication. But there are other simple things that can be done to prevent this condition. Here are some useful tips to prevent and control hypertension.
Eat healthy foods. Choose fruits, vegetables, whole grains, poultry, fish and low-fat dairy foods. Use less salt. Processed meats, canned foods, commercial soups, frozen dinners and certain breads can be hidden sources of salt. Check food labels for the sodium content. Limit foods and beverages that are high in sodium. A sodium intake of 1,500 milligrams a day or less is considered ideal for most adults. Avoid alcohol intake as much as possible. Even if you're healthy, alcohol can raise your blood pressure. Avoid smoking. Tobacco injures blood vessel walls and speeds up the process of hardening of the arteries. Maintain a healthy weight. If you're overweight or have obesity, losing weight can help control blood pressure and lower the risk of complications. Exercise. Regular exercise keeps the body healthy. It can lower blood pressure, ease stress, manage weight and reduce the risk of chronic health conditions. Exercise 30 to 35 minutes a day for 5 days a week is recommended. Practice good sleep habits. Poor sleep may increase the risk of heart disease and other chronic conditions. Adults should aim to get 7 to 9 hours of sleep daily. Kids often need more. Manage stress. Find ways to help reduce emotional stress. Getting more exercise, practicing mindfulness and connecting with others in support groups are some ways to reduce stress.
A wise man once said, prevention is better than cure. Now, you know about this silent killer and how to reduce the chances of being attacked by it and what to do when you are unfortunately attacked by it. If you have been diagnosed with hypertension, it's not the end of the road yet. If you comply with the lifestyle modification and take your drugs as prescribed by your doctor to control it and prevent its complication. And for those who do not have it, I encourage you to follow the preventive measure and to check your BP regularly from time to time. Always remember, your health, your choice. Until we meet again, take good care of your hearts.